Welcome to the Explainer. Okay, let's dive into this. Because today, we're looking at one of the absolute most ambitious technological rollouts in modern history. We are talking about upgrading the healthcare infrastructure of an entire subcontinent. It's a massive undertaking, and we're going to break down exactly how it's happening, why it matters, and how it's going to impact the daily lives of literally millions of people. So think about it for a second. How do you actually upgrade the healthcare of 1 billion people? It's not just about building more hospitals or training more doctors, though, that's definitely part of the equation. At its core, it is fundamentally a logistics and data problem. When you have well over 1 billion individuals interacting with this massive, completely decentralized network of medical providers, just keeping track of who needs what they've been prescribed, and what their complex medical history looks like, it is an absolute logistical mountain to climb.
Section 1. The small clinic problem, or as I like to call it, the paperwork bottleneck.
Now, to understand how we actually solve this mountain of a problem, we have to look at where the system gets jammed up in the first place. In a vast, diverse country like India, the front line of healthcare isn't always some massive, gleaming corporate hospital right in the center of a metropolis. More often than not, it's a neighborhood clinic. It's an independent, local practitioner operating out of a really small office, handling incredible volumes of patients every single day with, honestly, incredibly limited resources. And there's a sheer contrast between these two ends of the spectrum. On one side, we have the big corporate hospitals, right? They've got massive operating budgets, allowing them to implement sleek digital systems and maintain really expensive IT infrastructure. Their patient records are digitized, they're searchable and instantly accessible at the click of a button. But on the other side, we have the small local clinics. These guys are the unsung heroes of local healthcare, yet they're largely entirely paper-reliant, totally disconnected from larger health networks, and severely budget-constrained. It's a classic David and Goliath situation, but in this case, David is armed with a rusty filing cabinet and a pretty precarious stack of manila folders.
Let's look at what this actually means on the ground for these small clinics. The daily operational hurdles are just immense. We're talking about lost paper records. Imagine a patient returning after 2 years with a chronic illness, and their physical file is simply gone or maybe destroyed by humidity. Then there's the incredibly time-consuming administrative work. Doctors and their tiny staffs are spending hours manually filling out forms instead of actually treating patients. Plus, there's a complete lack of seamless data sharing. If a patient goes from a local clinic to a specialist in a bigger city, they literally have to carry their medical history in a plastic bag. And historically, the barriers to entry for fixing this, like buying the necessary software and hardware, have just been way too high.
Section 2. What is cloud management? Let's demystify the tech.
So how do we bypass these high physical barriers? We hear the word cloud thrown around constantly in the tech world. But in this context, cloud-based health management is essentially a digital system where patient records, appointment scheduling, and clinic operations are stored securely on remote internet servers rather than on a physical, expensive computer sitting right there in the doctor's office. So the crucial point is, you don't need a dedicated IT guy, you don't need to buy a massive server that takes up space, and you don't need to worry about the clinic's computer crashing and permanently losing all your patient files. All the heavy digital lifting is done elsewhere, securely, over the internet.
Let's map out how seamless this actually is in practice for our neighborhood doctor. Step 1, the patient visits the clinic for their checkup. Step 2, during or after the consultation, the doctor simply logs into a secure web browser on a standard, affordable laptop, or even just a tablet, and types the data directly into the cloud. And Step 3, those patient records are now accessible anywhere securely. If the doctor needs to check a specific lab result from home, they can. If the patient needs their history forwarded to another specialist, it's instantly and securely available. It takes technology from being this confusing IT burden and turns it into a necessary, everyday rescue tool that gives doctors their precious time back.
Section 3. The June 29 launch. Leveling the playing field.
Knowing that this specific technology is the key to unclogging the bottleneck, how do we actually get it into the hands of budget-constrained local clinics? Well, that brings us to the 29th of June. The government recognized a glaring gap. They saw that if small clinics simply couldn't afford to buy into the private digital health ecosystem, they were going to be permanently left behind. A public, totally accessible option had to be created to bring the front line of Indian healthcare into the 21st century.
And here is exactly what the resulting policy update looks like.
the government is launching an affordable, cloud-based hospital management system specifically tailored for small clinics. And this is vital to understand. This isn't some bloated, one-size-fits-all piece of enterprise software that was originally designed for massive hospitals and then scaled down awkwardly. No, this rollout is laser-focused on the exact needs, workflows, and limited budgets of the independent practitioners we just discussed. It is fundamentally designed to empower them, not overwhelm them with 50 different features they're never going to use.
Section 4. Why affordability is key. Breaking the cost barrier.
Now, as anyone in tech knows, the greatest software in the world is completely useless if the end user can't pay for it. Breaking this cost barrier is the true game changer for independent practices, and this brilliantly illustrates that shift. When we compare legacy enterprise software with the new government system, the contrast is obvious. Legacy enterprise software, it requires a high upfront cost, often thousands of dollars just for the basic license. It requires loud, hot local servers humming away in a closet, and it needs expensive IT staff on retainer to come fix it when it inevitably breaks down. Now look at the new government system. It's highly affordable, it is entirely cloud-based, and it requires absolutely zero local server maintenance. For a local clinic running on exceptionally tight margins, this isn't just a nice little software upgrade, it's the literal difference between staying stuck in the paper age or finally crossing the digital divide.
Section 5. The future of digital health. Let's zoom out a bit.
So, we've solved the problem for the individual independent clinic. But what happens when you multiply that single solution by tens of thousands of clinics across the entirety of India? Let's move to Colombo and see how this builds into incredible nationwide ripple effects. First, we get integration into national health data. This provides public health officials with real-time, anonymized data to accurately track disease outbreaks and allocate resources exactly where they're needed most. Second, we achieve way better patient continuity. A patient can move anywhere in the country, visit any connected local clinic, and their medical history seamlessly and securely follows them. And finally, we get a completely modernized structural infrastructure. The very foundation of the country's healthcare system upgrades from fragmented paper silos into a unified, living digital network.
Which leaves us with this final, truly provocative thought to ponder. If every small clinic in India is connected to the cloud today, what medical breakthroughs will that data power tomorrow? When you successfully and securely aggregate health data from over 1 billion people, you don't just improve daily checkups and ease administrative burdens, you create the ultimate foundation for advanced medical research, AI-driven diagnostics, and personalized medicine on a scale the world has literally never seen before. Upgrading the seemingly boring infrastructure of today is exactly how we unlock the miraculous cures of tomorrow. Thank you so much for joining me for this explainer. I really hope this helped you grasp the monumental shifts happening right now in global healthcare technology. Keep learning, stay curious, and I'll catch you on the next one.